Why is colon cancer no longer just a concern for the older generations? Traditionally viewed as a condition that primarily affects those over 50, recent data paints a different picture. Alarmingly, there's a noticeable upsurge in colorectal cancer cases among individuals younger than 50. This trend is not isolated to one region but is evident globally, sparking significant concern among health experts and necessitating a re-evaluation of how we understand and approach this disease. This shift demands a deeper look into what's behind these rising numbers. The numbers are speaking, and they're quite disturbing. According to the Pan American Health Organization, colorectal cancer ranks as the third most common cancer among men globally and second among women. The United States alone sees about 246,000 new cases each year, with approximately 112,000 deaths. What's even more alarming is the trend among younger adults. Dr. Paulo Hoff, a leading oncologist, points out a stark increase. If you compare the current data today with the rate 30 years ago, there is evidence of a 70% increase in colorectal cancer cases in relatively young patients. This observation isn't isolated. The United Nations Global Cancer Observatory highlights that 9 Latin American countries, including Brazil, Mexico, and Argentina, have seen significant increases in both cases and deaths since 1990. With such a significant rise, the call for global alert seems more justified than ever. From infectious to chronic, how have our lifestyles influenced this shift? As we delve into the evolving landscape of health, it's evident that our battle has shifted from infectious diseases to chronic ailments. Dr. Mauricio Mazza, a leading voice in cancer prevention, highlights a significant transformation driven by changes in our daily lives. This evolution is not just a medical observation, but a reflection of how deeply our lifestyle choices are intertwined with our health outcomes. In recent decades, dietary habits have undergone a dramatic transformation. Fast food, high in fats and sugars, has become more accessible, while sedentary lifestyles have become the norm rather than the exception. This shift has not only led to rising obesity rates, but has also increased the incidences of diseases like colorectal cancer. Moreover, the impact of smoking and alcohol consumption cannot be overstated. These factors, combined with a lack of physical activity, create a fertile ground for chronic diseases to take root and flourish. As we continue to connect the dots between lifestyle and health, it becomes clear that our daily choices might be quietly shaping a health crisis. As the threat grows, how is the world responding? In the face of mounting evidence, countries around the globe are taking significant strides to combat the rising incidence of colorectal cancer, particularly among younger populations. A pivotal shift can be seen in the United States, where the minimum age for an initial screening test for colorectal tumors has been reduced from 50 to 45. This policy change is a direct response to the growing data indicating an increased risk in younger adults. Beyond policy adjustments, there's a surge in research efforts aimed at understanding the nuances of this trend. Studies are delving into the lifestyle and genetic factors contributing to the early onset of this disease, aiming to tailor more effective prevention strategies. Internationally, collaborations are strengthening as countries share findings and strategies from Europe to Asia and from North to South America, reflecting a unified front against this disease. These proactive steps highlight the urgency of addressing this rising threat. Can awareness and early screening be our best defenses? Indeed, staying vigilant about colorectal cancer is critical. Early detection can significantly boost survival rates. When caught early, the chances of successful treatment skyrocket, underscoring the value of regular screening, especially as one approaches the recommended age. Acknowledging the shift in age demographics, it's vital to consider health choices and the benefits of early diagnostic tests. These steps are not just preventative, they're potentially life-saving. Staying informed and proactive could not only save lives, but also improve the quality of life for millions.